When you check into a hospital for surgery, you're placing your life into another person's hands. You trust that they're taking every precaution to keep you safe, but hospital memos and state inspection reports dug up by TV6 show a number of mistakes occurred in recent months at Genesis hospitals. Surgeons mistakenly operated on the wrong side of patients 4 times in 40 days. TV6 Investigates' Mark Stevens has been digging into these wrong site surgeries, and as he reports, medical experts say these types of mistakes should never happen.
Wrong site surgeries are part of a group of medical mistakes called never events. That means they're simply never supposed to happen, but they do. In that letter obtained by TV6 Investigates, Genesis Health System wrote to its employees that 4 wrong site surgeries had occurred within 40 days. In that letter, Genesis writes employees didn't always follow the hospital procedures meant to protect patients. We asked to speak with the CEO and Chief Medical Officer to find out what happened and what the health system was doing to prevent it in the future. Genesis had us talk to its Vice President of Corporate Communications.
The severity of the error is critical to understand. In the case of these 4 errors, no serious consequence reached the patient. Relatively speaking.
Genesis Health System Vice President of Corporate Communications Ken Kwqc says no one died and no one had the wrong limb amputated. But the Iowa Department of Inspections and Appeals found 2 wrong site surgeries occurred at Genesis hospitals within 2 weeks. On October 23rd, a surgeon at Genesis West cut into the left hip of an 80-year-old patient. The patient needed surgery on their broken right hip.
The surgeon began the initial incision, no muscle, no bone, the initial incision that would position the surgery to go forward.
The inspector found no written evidence that a key safety procedure called a timeout had been performed. That's when the operating team double-checks the patient, the procedure, and the site before cutting. The surgeon said he didn't participate in a timeout and didn't remember if the team did either. A nurse said she did a timeout but didn't write it down. Kwqc says there's no proof a timeout didn't occur.
The nurse noted there was a timeout, but clearly it had not been an effective timeout, because if it had been effective, it would not have happened.
The nurse stopped the surgery, and the team figured out the mistake. The surgeon closed the cut and did the surgery on the correct side.
I think there's no doubt that everyone would conclude that more attention should have been paid to are we on the right side.
On November 5th at Genesis East, a patient came in for thyroid surgery. They had a suspicious mass on the right half and were supposed to have the right half removed. But the doctor mistakenly ordered the left half removed. Nobody caught the error until after the surgery was done.
The surgeon removed the side, suggested that it should be removed, but when the physician got into the surgery, he became suspicious, went back to the original pathology report, and determined that it was the other side.
The surgical team reopened the patient's neck and removed the rest of the patient's thyroid. That half turned out to be cancerous. Standard procedure would have called for the entire thyroid's removal when that part was found to be cancerous.
We take very seriously the fact that there had been a miscommunication that occurred outside of our 4 walls and brought inside, but in this particular case, that patient avoided a second surgery.
Kwqc didn't have details on the remaining 2 wrong site surgeries Genesis discussed in its letter, but did say
they were also not serious safety events in that no lasting or serious harm occurred to the patient.
So what happened? In its letter to staff, Genesis found doctors were not fully participating in timeouts. At times, there were distractions, such as music playing in the background. Markings on a patient were covered up. Kwqc says staff members involved in a wrong site surgery are going through a disciplinary process.
I can assure you and the public that we take these timeouts very seriously, and privileges to work in this hospital are determined by compliance with our safety regulations.
The Iowa inspector also found Genesis failed to immediately implement a system to ensure timeouts occurred after these wrong site surgeries at Genesis East and West. The state calls it an immediate jeopardy. It means patients are at risk.
Why wasn't it addressed before a state survey agency ever got involved?
Well, it was addressed, which is how we came up with the plan. We reported it to the state survey team during their visit, but that doesn't suggest that we didn't react immediately.
4 in a 1 month period or 2 month period is completely unacceptable.
Dr. David Nash is a patient safety expert. He's the editor-in-chief of the Journal of American Medical Quality. He says modern medicine has worked to eliminate wrong site surgeries for decades. A 2013 study estimates wrong site surgeries occur as often as 50 times a week across the country. Nash says it only takes simple errors to accumulate for a wrong site surgery to occur.
A very busy operating room, very busy surgeon, some change in the general procedures of the day, and lo and behold, we get what's called the Swiss cheese effect, and an error occurs which could in fact lead to wrong site surgery.
There are multiple reasons wrong site surgeries happen. Researchers studying them in Colorado blamed poor planning and not following the timeout. Nash says it boils down to a hospital's patient safety culture.
In a culture that is a just culture, that recognizes human fallibility, that questions each other in a professional and appropriate manner, there should be 0 wrong site surgeries.
We do audits. We self-audit ourselves all the time.
Tom Feldman leads the Center for Health Ambulatory Surgery Center in Peoria. His staff participated in a Joint Commission study a year and a half ago. The goal? Figure out more ways to prevent wrong site surgery. His team performed a mock timeout for TV6 Investigates.
Let's do a timeout.
Date of birth is 5/8/1972. We're here for an open right carpal tunnel release. No implants. All agree?
I agree.
I agree.
It's important to just refocus and get with a couple true patient identifiers and name a date of birth, restate the procedure, and then go forward.
One process Feldman's Surgery Center found could lead to errors were doctors marking their patients slightly differently. Some used a dot, some their initials, some a yes. With 85 doctors doing surgery, Feldman decided to set a standard. Everyone must use their initials, period.
I think that has certainly helped draw attention to how important the marking really is.
The study also found the center's timeout had grown too complicated, so they simplified it to the 3 steps we saw.
All right, let's do a timeout.
We're doing a right open carpal tunnel release. No implants. Everybody agree? I agree.
I agree.
Feldman says he's glad they took part in the study. Overall, the Joint Commission found the 8 medical facilities who participated cut their risks of wrong site surgery in half. The Joint Commission created a tool for hospitals to use to cut their risks too.
It's everything from the surgeon's office to when it hits our scheduling to when it comes in here and the patient is prepped for surgery, and then ultimately when the surgeon goes to actually make the cut or begin the surgery.
Genesis submitted a plan of corrections to regulators addressing the problems the inspector found.
We have done so, and they have agreed that our plan is effective.
Fixes include the following. Everyone must participate in a timeout. A patient's skin marking must be visible. Timeouts will be audited in person.
It's our philosophy here, and again, it has earned us national recognition, that safety is the most important of all of our objectives.
Inspectors conducted a follow-up inspection at Genesis in early February. They found Genesis was back in compliance with federal regulations. Had they found otherwise, Genesis would have been terminated from participating in the Medicare program.
Keep watching TV6. In the coming weeks, we'll show you how wrong site surgeries kicked off a push at the state level to report them and how Iowa and Illinois measure up. And if there's a story you want us to investigate, send it straight to 6. You can do that by emailing us at news@kwqc.com. You can also reach us on our tip line or send us a message on Twitter or Facebook. Wrong site surgeries are what doctors call never events. They should never happen, but it's tough for patients to find out if their hospital had any.
Earlier this month, TV6 Investigates revealed a state inspection citing Genesis Health System for failing to protect patients from wrong site surgeries at its hospitals. Genesis has since submitted a plan of corrections to fix what the inspector found, but patients have no way to find out how common wrong site surgeries are at any Iowa or Illinois hospital.
TV6 investigates why mandatory public reporting on never events in our states doesn't exist. Investigative reporter Mark Stevens joins us. And Mark, half the states across the country have some type of reporting system.
Yeah, the states in blue all have public adverse event reporting systems. These systems typically gather data on wrong site surgeries, patients given the wrong medication, and patients with tools left in their body after surgery. These mistakes are all known as never events. They're never supposed to happen. Illinois created a reporting system over a decade ago, but it's still not operational because the state has never funded it. Iowa came close to implementing a system, but a state board never voted on it.
The public deserves complete and thorough transparency and accountability from the medical system. I am an absolute strong believer in that and always have been.
Dr. David Nash is a patient safety expert and an advocate for public reporting systems. He's the editor-in-chief of the American Journal of Medical Quality. He was one of the first to publish a study comparing Philadelphia hospitals against their track records for open heart surgery. He says public data improves care.
We also have had literally 2 decades of public reporting, maybe not always about wrong site surgery, but certainly about the outcomes of many different types of surgery. So I firmly believe that public reporting has contributed mightily to reducing wrong site surgery, reducing postoperative infection.
State adverse event reporting systems were created in response to reports studying preventable medical errors. A Health and Human Services Inspector General report measured medical errors in Medicare patients who went to the hospital in October 2008. Of the 1 million Medicare patients discharged during that month, the Inspector General found 1 in 7 experienced an adverse event.
Medical error, all medical error that is preventable, is the 4th leading cause of death in our country in 2016, and it's hard to believe.
I thought it would be a really good idea for Iowa to expose to the public in a very scientific and straightforward way, one that had been approved by 28 other states, and make those kinds of events transparent.
Dean Lerner used to run the Iowa Department of Inspections and Appeals. That agency inspects hospitals. He believed implementing mandatory public reporting would improve care in Iowa.
If you ask an Iowan whether having this information would be valuable and important to them in the scheme of things in terms of their care, they will tell you yes.
Lerner brought his proposal to the Hospital Licensing Board back in 2010. The minutes of 2 meetings show the board had a lot of questions. How would this data improve care? What had other states experienced? How would the data be used? The former chairman of the Hospital Licensing Board, Bob Miller, says those were critical questions.
It did not appear to us that there was a plan to what to do with the information that would be gathered.
Miller said the board also felt a state-run public reporting system was redundant.
We felt that there was a lot of reporting going on through the collaborative and required by CMS and for our relicensure, Joint Commission of Accreditation, all had criteria there.
The Iowa Healthcare Collaborative has gathered data voluntarily from all hospitals in the state since 2007. Its CEO, Dr. Tom Evans, says the group publishes a report comparing hospital performance across the state.
The never events are a starting point. They were a very popular thing to start talking about in the early 2000s, but we've moved so much farther beyond that.
But he says the report has flaws. It's very technical, so patients in the state may not understand what is being compared and why those comparisons are important. He says they're working on improving it.
We want consumers to be engaged with meaningful information. So we have other things, tracking infection rates and antibiotic usage and falls and pressure ulcers.
Evans believes focusing on never events like wrong site surgeries is distracting.
I want consumers engaged. I want them looking at this information, and we want to be transparent, but we've got to give consumers meaningful information that they can make good healthcare decisions based upon.
Miller says those concerns were key in the discussion.
Is it going to improve quality care, or is it going to penalize an error?
Lerner says he needed the board's support to move forward with a state public reporting system. he planned to answer questions as they came up.
We didn't want to, jump with both feet before we, carefully, analyzed everything, was to take this one step at a time. And I honestly thought that that would help industry to adjust and get comfortable with the change.
At that meeting back in 2010, Chairman Bob Miller twice called for a motion on the proposal to create a public adverse event reporting system. No one on the board made one. The idea died without anyone casting a vote. Never events at Iowa hospitals continue to remain hidden from public view. Iowa hospitals are not required to publicly report never events to anyone. Patient safety advocate David Nash says adverse events should be public knowledge.
If we're going to have consumer engagement in healthcare and consumers having more skin in the game and higher deductibles, they have every right to be able to connect the dots between what hospital is in my network and what are the outcomes of care for procedures that I may need or family members need in those institutions.
Mark, let's look at the big picture on this now. If I have a family member or me perhaps wants to go and wants to know something about the hospitals that may be performing a surgery on me, is there at least a national database that tracks this kind of information?
No, there is no national mandatory public adverse event reporting system. There are different tools out there that the public has access to. Medicare has a hospital compare website. The Leapfrog Group scores hospitals, and ProPublica even scores surgeons, but no one specifically focuses on adverse events like wrong site surgeries.
Interesting to see how this develops, Mark. Good work in the reporting, and we look forward to updates on this.